Welcome to tonight's talk on reversing diabetes. For those of you that don't know me, I'm Dr. Sean, or for those of you that should know me and you forgot my name, I'm Dr. Sean. So tonight we've got a really good talk for you because diabetes is running rampant through our country. A lot of people don't even know they have it. The statistics say that 25% of people who have diabetes don't even know they have it. The statistics also say that 1 out of 2 Americans is either diabetic or pre-diabetic, meaning you're right on the verge of diabetes. So that means, as the stats go, right now in this room there's 1, 2, 3, 4, 5, 6, 7 of us. 3 or 4 of us either have diabetes right now, maybe we almost have diabetes, 25% of us don't know about it. So it's a really important thing to understand and learn about, and that's what we're talking about tonight. There we go. You're probably going to have questions as I go through this, and I hope you do. I encourage questions. I like them because it shows interest. However, with all of these talks, one of my goals is to try to keep them short, okay? And I'm still working on that. Sometimes I get wordy, sometimes I take too many questions, right? Marcy and Harold know. My goal is to get through this fairly quickly for you so you get the information but you're not here all night long, okay? Because I want to invite you to keep coming back for these. I hold a different talk every month and they're always good to learn about your health. There will be different topics, but they're all important, okay? So if you have questions, great. I'm just going to ask that you leave them till the end. I will stick around for a few minutes and answer a few questions if you guys have any. So the first slide, let's get started here. I'm excited, pumped up. Risk factors for type 2 diabetes. What this means is the more of these things on this list that pertain to you, the greater your risk is for having or developing type 2 diabetes. Now, I should say this before we get too far into this. There is a difference between type 1 diabetes and type 2 diabetes. And most of what we're going to be talking about tonight really pertains more to type 2 diabetes. I'm not going to get too much into the differences between them, but most of what I talk about is going to be type 2 diabetes. But understand that everything that I talk about tonight also plays a role to some degree with type 1 diabetes, okay? Tonight we're going to talk about how diabetes is completely reversible, completely preventable if you know what to do. Type 1 is a little bit different animal. That one you might not be able to completely reverse or get rid of, but if you follow what I'm going to teach you tonight, you can at least make it a lot better, substantially reduce your need for insulin or medications that you're on. And some people have totally reversed it. There's documented cases, but I don't want to make promises that I can't keep. So if you're sitting in the room today and you have type 1 diabetes, I don't want you to feel like I'm promising you can 100% reverse that. But we can definitely make it better and maybe reverse that. But type 2, yes, we can reverse it. So risk factors for type 2 diabetes include these. Family history. So if anybody in your family, your mom, your dad, your grandma, grandpa, brothers, sisters, aunts, uncles, if they have diabetes, you have a greater risk factor of having diabetes. If you're over the age of 55, our risk increases with age. The older we get, the more at risk we are for type 2 diabetes. Your race or ethnicity plays a role. I don't really see a whole lot of diversity in the room, so I'm not really going to hammer on that one too much. Insulin resistance syndrome. In other words, are you tired a lot? That can be one of the best signs or symptoms to realizing that you have some blood sugar problems if you find yourself tired more than you should be. Being overweight. Excess weight is pretty much a risk factor for everything, and type 2 diabetes is the same. If you have excess weight, you're more likely to be diabetic. High blood pressure, high cholesterol, history of gestational diabetes, meaning if you had diabetes when you were pregnant, and then inactivity or lack of exercise. If we don't move much, that again puts us at greater risk for type 2 diabetes. So again, some of us in the room might already know we have it. Some of us might not know for sure. Some of us don't have it. But the more of these things that pertain to you, I want you to understand the greater your risk for developing type 2 diabetes is. So, like I mentioned when I first started, Diabetes is an epidemic, meaning it's a big problem throughout the entire country. I already told you a couple of these stats, but look at this. I mean, I don't really like stats for the most part because I think they're boring. They're just numbers. But this is telling you how big of a problem we have in this country. Over 70 million people have diabetes in the United States. 70 million people. 1 in 2 are diabetic or pre-diabetic. I mentioned that. 25% of people don't know it. 1.5 million new cases are diagnosed every year. And here's what I really want you to understand tonight. And ignore all the other stats. Nearly every one of these cases we're talking about is preventable or 100% reversible. You just have to know what to do and then be willing to do it, okay? There's lots of people that are on insulin and other drugs probably because they didn't know there was any other options, right? Tonight you're going to know there's other options. Type 2 diabetes. It used to be known as adult onset, meaning that we really didn't see it in kids. You only got it as an adult, and it was usually it came from you not living your life the way you should have been. It finally caught up with you that you weren't eating a good diet, you weren't exercising enough, and it's finally catching up with you. Well, now we're finding kids as young as 5, documented cases, being diagnosed with type 2 diabetes. So it's really no longer adult onset diabetes. Okay, it's a problem for any age, which means that as young as 5 years old, we're not teaching our kids how to live a proper life, be healthy. So here was a study done, Wake Forest University in North Carolina. And the reason I put this on here is because what I run into is a lot of people who say, oh yeah, doc, I have diabetes, but my doctor's managing it just fine. And what they mean by that is, well, I went to the doctor and they have me on insulin or they have me on another medication and they told me that it's fine, it's under control. Okay, I want you to understand that studies are being done, like this one that I put on this PowerPoint slide, showing you that there's a significant risk for being on the medications for diabetes. So you might think it's being managed just fine, but let me tell you, it's killing you. It really is over the long run. Look at this study. The risk of heart failure, meaning your heart stops, it quits working, in patients taking diabetes drugs can be up to 100% higher than those who forego the drugs. What that means is if you have diabetes and you decide to take one of these drugs your doctor recommends, you have twice the likelihood of having your heart fail than if you didn't take those drugs. That's what that statistic's saying. Study out of Wake Forest. More than 65% of all people with diabetes, what do you think they die of? Well, voila, it's heart disease. What a coincidence, huh? The exact drugs our doctors are giving are causing heart disease. So the people that have diabetes, they're most likely to die of a heart attack. Their heart's going to quit. Why? Because of the drug that they were on. The more that you're around me, and the more of these talks you come to, the more you learn about what I know, what I try to teach you, you're going to realize every drug you take has side effects, and they're not good side effects. Some of them you might realize and know about, some of them you don't, but it's very important for you to be aware of the fact that there's not a single drug that was ever made that doesn't have side effects, okay? And this is a serious one, because it kills people. So, this slide says, is Avandia the next Vioxx? For those of you that don't know what Vioxx is, or you're not aware of it, a few years ago, Vioxx was a very popular drug that was given by medical doctors to people who had pain. It was a very popular arthritis medication, but given for low back pain, aches and pains, okay? And it did a good job. It helped take away your pain, but you know what they found it was doing? It was killing people. It was causing heart attacks. And so the FDA took it off the market. Well, now we're realizing the same thing with Avandia, which is a very popular drug for type 2 diabetes. We're finding, guess what, it causes heart attacks. And it's probably right around the corner the FDA is going to yank that one off too. I don't know why they haven't already, but it's still on the market, last I checked. Avandia is the prescription, or the main brand name, that's what I'm trying to say. I also want you to realize that some of these other terms, rosiglitazone, Avandament, Avandarl, all of those, they're all Avandia. But they're called different things because you might get it in a generic form. You might get it in a combination with another drug, and then they call it something else. But I want you to understand that if you're taking any of those, or your doctor ever tells you to take those, that's the one that was studied that says that it increases your risk of heart disease, your heart failing, by 100%, doubles your risk. So, it's not good enough that your diabetes is being managed okay by your medical doctor. That's what I want you to understand by that. And I'm not here to bash medical doctors. I think they're good people. They just don't have any better tools to offer you, is really what it comes down to. So, diabetes, it costs us a lot of money. Once somebody's diagnosed with this, there's some statistics here as far as how much it costs the rest of your life to live with diabetes. And this can be a problem, one, for each individual, because if you don't have insurance, you have to bear this cost or just suffer with the disease. And you're going to see these costs can be pretty overwhelming. Or two, maybe you have insurance, so you think, well, it's not all my cost, but understand you're paying premiums. When you spend that much money in insurance, the premiums go up for everybody because insurance always makes their money. They're never going to lose. So the premiums go up for everybody. The point is there's a cost on our economy as a whole. The sicker we get as a nation, the more cost there is on the economy as a whole. Take a look at this. So for a man or a woman diagnosed at age 50 with type 2 diabetes, so they're going to live with diabetes the rest of their life starting at 50, on the average, that costs $172,000 for one person. That's ridiculous. Let's back it up. Let's say they get diagnosed at age 30, 20 years earlier. So they're going to live the rest of their life from 30 on with diabetes and have to manage that. How much is that going to cost? $305,000. So just imagine how much it costs the 5-year-olds, right? If you're not diagnosed at 5 years old, back that up. I don't have that statistic. I didn't do the numbers. Significantly more. You get the idea of how much it costs us, each individuals, as a group, as a nation. It's the cost of ignorance, right? That's what it's costing us. $305,000 a year, or $305,000 total if you're diagnosed by 30, because you're ignorant to the fact of diabetes and how to treat it correctly. That's what it's costing us, right? And I'm not here to make you feel like a bad person. You're a great person because you're here to learn what you need to do. But that's really what it is. We're ignorant to what we need to be doing to fix this. I don't know if there's anybody in here that's ever seen The Matrix, or there's any Matrix fans. Actually, I know there's a couple people in here that have seen The Matrix. But this is a picture of The Matrix. Morpheus is offering Neo 2 pills, and he's saying, which one would you like? One pill will keep you ignorant so you don't really know what's going on. The other one will tell you the truth so that you really know what's going on, right? The question is, which pill do you want? Do you want to remain ignorant the rest of your life, keep taking the meds that are killing you, costing society a fortune, and just not worry about it or really know about it? You want to take the ignorant pill, or do you want to take the truth pill and really learn what you can do for yourself to get better, right? Because it's a decision. You guys have all made a decision, one, to come here tonight. Good for you. You all deserve a clap and a pat on the back, because that's the first step to learning about this stuff. Now, the second step is you applying it throughout your life, right? Knowledge is useless if we don't apply it. So, apply it. Learn it and apply it. Understand this, that treatments for diabetes, which either come in the form of shots or medicine, treatments that concentrate merely on lowering blood sugar by raising insulin levels actually worsen your condition rather than remedy the problem. Here's what I'm trying to say with this. If you're being treated by your medical doctor for type 2 diabetes, you're either on a medication or you're taking insulin shots. It's one or the other. In the goal of that, there's only 2 goals that those things can do. One is you can shoot insulin, which puts more insulin into your system, or you can take some drugs that make your cells more sensitive to the insulin that's already in there. Okay? That's the drug approach. And what this statement is saying is that when you do that, you actually are making the condition worse. Okay? You might be covering up the problem in the real short run, but you're ultimately making the problem worse. And here's why.